We already heard earlier today about the importance of collective action initiatives. Now we've been hearing about emerging ethical dilemmas born through health technologies. Let's hear what patients have to say, ultimately as the center of what all of healthcare is ultimately about. So it's a real pleasure for me to introduce Russell Williams, the Vice President of Diabetes Canada and patient co-chair of the APEC Biopharmaceutical Working Group on Ethics. Russell is a long-standing champion and an expert on global efforts to strengthen ethics in healthcare. He's also no stranger to the region. Russell has been instrumental in supporting the Chilean Consensus Framework's early foundation, as well as serving as the co-chair of the expert working group that developed the APEC Mexico City principles. Russell, thank you so much for being here. The floor is yours.
Thanks so much, Andrew. It's a pleasure to be here, and it's wonderful to see so many people participating in this workshop. I look forward to a really exciting dialogue, and as you said, Andrew, patients are at the center of everything that what we do. And patient voices should be, and many times are, but always should be at the front line as both the public and private sector are dealing and delivering healthcare. Clearly, one of the emerging issues that we're seeing and dilemmas or challenges are the relationships between data, health data sharing and privacy. So today we put together a number of speakers, international, national, as well as some other stakeholders to help talk about what is happening now and to understand what practices are being taken to ensure integrity. Today we're going to be, and it's a short session, but we're going to be looking for actionable items. There's a wide variety of programs, laws, strategies, perspectives on this question. You're going to hear about some of them today. My sense is there's a real willingness to come up with solutions. And to balance this question and to make sure that patients are front and center and co-creating the solutions from the beginning to the end. So even in Canada, very quickly, we have in diabetes, we have challenges when we look at the data that we have and our ability to share that to improve healthcare. If there's time, we might even chat about this. So as we move through this session, let us think about what are the actionable items that we can pass on to the Summit of Americas. And with that brief introduction, and I'm not going to introduce the speakers today, but I'm going to ask them all just to maybe open up and briefly introduce yourselves and your organizations and provide a local context of how your organization or your country views ethics issues related to health data sharing as well as privacy. So I think we'll go in the order of Maria, Mercedes, Gonzalo, Karla, and then Kowaldin. So with that, Maria, would you like to start off? María, can you hear us?
Muy buenos días a todos. Muchísimas gracias por la invitación. Soy María Mercedes Rueda, colombiana.
Good morning. Thank you for inviting me. I'm María Mercedes from Colombia. I have RA since 46 years, and I'm a survivor of breast cancer for 30 years. Fundare chapter Bogotá was created to help rheumatic patients and was created in 2002 by a rheumatologist that gathered a group of patients and invited us to create this foundation. In 2004, Fundare National was created and created chapters in different cities of the country. Today, we have 10 chapters, and we have about 5,000 patients in our organization. Our key work is to educate about health, patients about self-care, empowerment, because they will have better outcomes. We follow up patients, caregivers. We provide counseling, legal counseling to overcome access barriers when they face them. And we also work on the political side with a movement called Patient Colombia. With that, since we have patients, we have databases that are very sensitive So we take care of them as if they were gold, and we respect the privacy of the patients. They have already offered us to buy these databases, but we did not accept that. Unfortunately, there are people that sell those databases for banks so that they can offer credit cards or store cards. And the same way, if these databases get to other hands, then it's possible that the patient will not get a job, for example, because they have a disease and they face stigma, or they may not get a credit. Since I'm a cancer survivor, sometimes I will not get credit. So when the whole family is involved in this type of information, it's very complicated. So we have to be very respectful and do not share these databases. Thank you.
Thank you, Maria. That's great. And if the others can give a quick overview of their organization and their country views on ethics related to health data sharing and privacy. Moving on to Gonzalo, please.
Hola, buenos días. Los saludo desde Viña del Mar, Chile. Mi nombre es Gonzalo Tobar Carrizo.
Hello, good morning. My name is Gonzalo Carrizo. I'm speaking from Chile. I'm not a patient. I'm a brother of a patient with lupus. So I work at Lupus Chile and in other instances of the civil society. And today I preside the Chilean Alliance of Patients. And considering this Chilean Alliance, we have transversal patients and have a chronicity point of view to give diagnostics of what's going on in the Chilean reality, to make propositions based on the families. We work with public policies and on a transversal matter for all users, not only patients that are rheumatic or have cancer, but the totality of chronic diseases. Regarding the sharing of data, we are very concerned because these are data from patients. So in that sense, we are very concerned about data because we do not have a complete protection in Chile. And with civil society, we are trying to raise more awareness about this concern so that the authorities will consider that and can create a more robust law about that.
Thank you. Thank you so much, Gonzalo. I appreciate that. And now moving over to Karla.
Muy buenos días, Russell. Muy buenos días a todos. Es un honor participar en el
Good morning, everyone. It's an honor to be here. Thank you for having me at this forum. I am the executive director from ESPERANTRA. I have a master's in administration, business administration, and I contribute with the improving the quality of life of patients with chronic diseases and rare diseases and cancer. I contributed recognizing their voices as a key part of decision-making in healthcare, focused on patients. And I have the honor of developing the first code of conduct in Peru, and that was really an interesting experience. Today, based on my place in the Patient Alliance and 100 countries, we are able to share this type of experience of good practices so that organizations of patients are more professional and may generate more trust as an important liaison between multiple stakeholders to give voice and to have data sharing to contribute among our countries. Today, our patients do not trust much their governments. And when we talk about sensitive data from patients' organizations, we still have to generate more trust. We think that the patient has to be educated, knowing how valuable their data is, and also anonymized data that can contribute to public policies. We still have a lot of opportunities to go. Thank you.
Thank you, Karla. And Qualdeep, would you like to conclude this first round of comments, please?
Yes, mine's a fast one. I think I cut to the chase. We're the International Alliance of Patients Organizations. We are driving change at the framework level, which means that we need to have global treaties, which means bringing in the WHO and the United Nations General Assembly into that issue. We cannot deal with data sharing and ethics in healthcare, and especially with genomics in as we heard from previous cases, as a sovereign matter, piece by piece, country by country. We need to work all together. And I think post-pandemic, I think that's taught us a big lesson. We must work in global solidarity and national unity. It was creating a new framework to harvest and to enjoy the benefits that AI, data, and personalized healthcare brings. And this means we do need to work on moving our attitudes and shaping our new legal and policy frameworks globally and nationally as one goal. Maybe an APEC new treaty for all the APEC members. Thank you.
Qualdeep, thank you very much. When we're thinking about action items as for the Summit of Americas, to take note of the notion of a joint treaty statement program, I think we should. That's an excellent point. And I just wanted to really say that so much of what I've heard today is we've been hearing from patient groups around the entire patient network of APEC. Needing to treat information like gold, to build the strong communication network, to build capacity, shared best practices, that the level of trust in the system isn't high enough yet, and we need to work on that. And so, but yet the notion of getting anonymized data and using it to our benefit is important in driving us. So I really do thank you for your introductory comments of each of the panelists. I'm going to move into a little bit of a question and answer period, and maybe give the panelists a little more time to answer some of the questions. And we'll start off with Maria Mercedes, and the question is, what are you seeing as best practices when it comes to supporting patients in health data sharing and privacy? And then maybe a little change in plan is that if you can give an overview, and then maybe some of the speakers, if they so wish, would like to add a couple of comments before we move on to the next question. So over to you, Maria.
Bueno, muchísimas gracias.
Thank you very much. In Colombia, there is two data protection laws. So we have two data protection laws. The first one is the state law 1581 from 2012. And in this law, unfortunately, we didn't follow it thoroughly. We have a decree 1443 from 1997. And for patients with HIV, and it tells you to not manage the sensitive data of the patients, even though whatever they did previously, because this is something very private and we should respect. Unfortunately, this is also not fulfilled. In Colombia, we have been wanting to manage the clinical electronic story. We need to have their history, because if the patient is going to have all services divided, then they're going to have to go to many places. And if they have one unified history, it will be less costly, because the doctor is already going to be able to check the tests and everything that this patient has done, and will be able to give better treatment to this patient. However, the part that we still wonder about is that if these data are actually going to be managed confidentially. Another big problem that we have for the unified history is that Colombia, unfortunately, does not have internet all over the country. And also, unfortunately, there are problems that sometimes come to, sometimes we don't have light, we don't have energy. So if we have a history which is electronic, it's going to be completely disconnected. But in light of the pandemic, we have seen that telemedicine is something very important. I, as a patient, I've had the opportunity of, getting service via telemedicine, and it is necessary to give an informed consent before the consultation. This is being done here so that, you can authorize someone to provide their information to the telemedicine. So I understand that telemedicine, it's here to stay. And not only during the pandemic, but also there are patients, for example, in case of rheumatic patients, if they are controlled, but they need, I don't know, maybe a wheelchair, they need support, they need support. Bogotá has crazy traffic. Maybe they need a taxi or a car for 2 hours or something like that. They're going to maybe lose half a morning or the full day to go to a doctor's appointment. And we see that telemedicine, if it's well managed with privacy, and if we're respecting the patient's data, it's something that is going to be very helpful. The same goes for patients that live far away. Because, for example, rheumatologists, there are only 250 rheumatologists at the national level in Colombia, and they are mainly centered in the main cities, the big cities. So if we're able to manage the data with the entire confidentiality, I believe that this could have great results. Another part for the future is to be able to manage the big patient organizations. For example, here in Colombia, breast cancer associations manage a lot of patients which can use the tool CRM, which is Customer Relationship Management Tools. And they are actually very important to be able to manage data, and it's a lot quicker when you have a big database. We don't have such a high patient number, but for the future, I think it's something very important if we maintain the confidentiality of the patients and we have ethics in this entire management part.
Thank you, Maria.
You're welcome.
Before moving on to the next question, does any of the other panelists want to make any comment about Maria's comments, or I'll move on to the next question?
Just to say, yes, Maria, you're on the right track. I think you're concentrating on the right things. We do need that framework made solid and responsible. I think otherwise we tend to lose much of that responsibility that's shared between states, especially when things go wrong, then everybody pulls out and we are left alone. So we do need the state held accountable. Very nice idea.
Thank you. I agree, and I'm hearing consistently that we do need a framework. We need it clear. We need it transparent. And Maria, you were really talking about we have to be absolutely clear on confidentiality. That should not be in question at all, and being able to use proper systems that to track the data, one, to benefit from it, but also to make sure that it's protected. And circling back to the need of a law or framework, and then making sure patients have an input into the development of the law. Well, thank you. So maybe move on to looking to the future, and I'd ask the other panelists to each comment about what can patient organizations and other stakeholders, and not just thinking about what patient organizations to do, but what can other organizations along with patient groups, including governments, do differently What can they do differently? But what can they do now, right now? But also what we can, as we're thinking about action items for the Summit of Americans, what could they be doing differently in the future when it comes to establishing and addressing these dilemmas affecting health data sharing and privacy? So concrete ideas of what patient groups could do, other stakeholders and governments could do in the future. Maybe start off with Gonzalo, sorry, and then over to Karla and Quality. Thank you.
Muchas gracias, Russell. Quiero aprovechar de
Thank you so
saludar.
much, Russell. I would like to talk to Karla and Maria and also Kowaldi. Hello to everyone. And I would like to talk about the last question you asked and say that the reality in Chile is very similar to what Maria Mercedes mentioned. So in Chile, and also maybe Karla will be able to tell us as well, but Chile, Colombia, Peru, they are South American countries with similar cultures and a similar way to do things. Our democracy sometimes is not very strong, and social movements have been getting stronger and stronger. So we do have a very conducting wire that crosses the continent and it kind of makes us the same. Data protection is key conversation that we need to talk in all states from inside the states, not the government, not the politicians, but us as a social society as well. In Chile, for example, we have a data protection law from 1999. So it was created, many years ago. Maria Mercedes was saying that hers was created in 2012. So it's urgent that we have a modern data protection law in which we have special data that today's law doesn't integrate. Health data, genetic data, like we mentioned as well, where today with digitalized medicine, we know that that is urgent. And the technological advancement in health in Chile has been really accelerated, but it means that we have a protection of personal data. And in Chile, like we have a lot of bureaucracy and, this legal protection doesn't come at the same time and it doesn't work at the same time as the technological advancements. The pandemic, as Maria Mercedes was saying, has totally put relevance in telemedicine, where we are able to have in such a big country a lot of things that are easier, and it's totally necessary, and it's a key tool for people to, we need to pay attention, but we also need to protect and regulate data that can be managed through that. So us in South America, we do have this centralism where everything is focused in the big capital cities. However, we have the rest of the population, which is all over the country. They don't have access. So telemedicine has given them access during the pandemic, but we still need to have more regulation about it. One strong personal data protection law is going to be very important to help the patient relationship. And this is a need that has been raised from the organization of patients that don't have a lot of sickness as well as the chronic diseases. And we need to know how many people have with each sickness. Today, we don't have a registration and official numbers from the health system and the authorities that tell us how many patients there are with one specific sickness or another one. There's not enough data. There's very few specific data for very few illnesses. So this is a necessity, and we want to know how many like me there are. How many have the same thing I do? How many people can I have a relationship with as well? But for that, we need to have registration. And for that, we're also, sure that this registration is going to be anonymous and it's not going to go to, the wrong hands. And connected to what Karla said, our patients and our people have distrust related to our authorities or our governments, whatever color it is, when we talk about handling personal data. So there is also a trust building work that needs to be done together with the public to try to understand that this type of data is going to be handled in such a way. The clinical information Maria Mercedes also mentioned in something that was pending. Us as patients are raising the necessity that the patient needs to have a unified technical history for when they go to another doctor, when they change cities, they don't have to go from scratch telling their entire story with a folder with their entire information. For that, we need to have proper treatment, and we don't need these data. This data can't be lost. They can't be shared. The banks can't know about it. The insurance companies can't know about it. So, I've had a bad experience with data as well, with geolocalization of patients with COVID-19 at the beginning of the pandemic, where there was, a data breach, and they were able to locate each of the patients that had this sickness active. And to finish, I will tell you that today in Chile, we are in a historic period. So it's very important for our nation because we're in the middle of a process of a constitution change where we want to have a new constitution for the country that is going to bring us new institutionality. And the personal data handling nowadays doesn't even have any constitutional protection. So that's why this is an opportunity for all the interested parts, which are patients, us who own the data, the governments, the industries, the professionals, the academy, and so on, so that we can be part of the change and understand the need of data protection, more robust data protection than what we have today. Also, maybe we can have a constitutional protection to personal data, because finally we're going to be able to have the right to property on these personal information that are so sensitive. Thank you so much, Russell.
Thank you so much, Gonzalo. I've got a lot of questions there, but I'm going to go over to the other panelists, and then maybe we have some time for a quick conversation. Very insightful. So thank you very much for that. Over to Karla now.
Sí, Russell. Las organizaciones de pacientes como usuarios de los servicios de salud.
Thank you, Russell. The organizations of patients and representatives and voices of the patients should professionalize and know the impact of data sharing and privacy, and as well as the risks. We know that the patients do not trust and do not authorize the sharing of data, and then we lose. So the pandemic taught us good lessons and advances, especially in South America that did not have those type of technologies. For example, clinical history digitized. In countries like ours, there's a fragmentation of the healthcare system. So if we have a digital medical history in a system and then we move to other systems, they are not unified, so to speak. So it's hard to use the data correctly. The pandemic also taught us that we have to overcome barriers. Sharing of data is technically possible, but it's regulated by different institutions, and there's also ethical issues and the misuse. The organization of patients have to co-build trust in this fight to build trust and educate patients about the positive impact of data sharing, and obviously with anonymous data that is sensitive or that the patient does not want to share. Regarding the government, we have to guarantee the education so that we use a easy language so that citizens can understand the need to decentralization, to reach all patients in all areas of the country. Maria Mercedes was talking about the internet and technology reaching far-reached places, and this is very important. Transparency as well, and inclusion of citizens and co-building these public policies is important, because if we do not participate, how can we build something for the patients without the patients? And also accountability. We have to see how is it advancing and how it's important to share our data. In the private sector, it's really important to show what's positive, because we will have intersection points, we will have common goals with all stakeholders. And in that case, the private sector, sometimes the private sector has to move from the commercial side of the business and then just pay attention to the patient and what they need. And finally, us all stakeholders have to build a healthcare system considering what's good, sharing what's positive, respecting everything that it needs to be respected. Obviously, including the patient voices that can show us what is important for the healthcare system and what they need.
Thank you, Karla. Very helpful comments and building on a lot of what we've already been talking about. So thank you. And to conclude this level of the first round of questions here, Qualdeep, if you want to add your comments to the question about what can we be doing differently in the system now and in the future, it's over to you.
Yeah, thank you very much, Russell. I think I'll start from the failures that we have had. We have not shared, or we have not promoted the benefits that accrue from this sharing of data, especially in the genomics field. I think we need to work very closely with the scientific community to bring that out at the moment. As you know, with the genomics, we have got tremendous potential for precision medicine, looking at precision oncology, precision diabetes, and all this has not been transmitted to the patients as such. Then we need to move away from the traditional fears that we have about jobs and legal law, access to information, bank accounts. We need to break that somehow between the two. And this then brings into building that trust. We must co-produce this together. There must be co-creation. And that means that patients should be part of the government right through and through, right down to the bottom level. You know, it's not as if patients are subject matters. We should be not only access for consultation, we should be in the cabinet. And this means the innovative medicines or other whole party, we should be there. We should be in every ministry head, whoever will touch upon this. And then we should be brought in right down to the bottom within each and every pharmaceutical company that is there, which will work on this to bring this issue along. And that will build trust. I think when you have oversight, you have people like yourself representing you, you see that representation is there, and that will create that trust. And not to forget that we have not shared the benefits that accrue, that you will get treatment that is right for you. It will target the right patient, the right time, very early on, and you could be home sooner than you thought. You wouldn't have to risk delayed cancer treatments and high-risk operations if your cancer is caught through sharing your data beforehand, genomics and personalizing, anonymizing it. So that's what we need to do. We need to bring back that fear, overcome that fear. I think that Frankenstein fear, I think, still remains, that you fear the machine and doctors, and you think they're going to create a monster. That needs to overcome as well. I think that is very important for us. Thank you.
Thank you, Qualdeep, and thank you all for your comments. Maybe I'd like to pursue a little bit more the notion of trust, since you've all mentioned it, but maybe to kind of quickly highlight some of the things that I've been hearing in this workshop is clearly the need to build trust. And I recall when we created the multi-stakeholder consensus frameworks, that's the body that we thought that could be one of the bodies to help to develop that. The need to unequivocally protect data, whether it's laws, regulations, and upgrading and modernizing some of the regulations. The need to educate, and I think it was educate patients, but it was educate everybody in this whole process, and obviously educate it in a manner that makes sense to them. Very strong messaging about co-creating, co-building, full engagement to every level of the process, and versus just add-on consultations, and to be fully there, and then to build in a certain transparent and very clear transparency and very clear accountability. interesting that we also noted that there's learnings that we had through the pandemic of how to do things differently and how to improve and how to start to change the process. But some of the last points of really starting to also educate people on the benefits of data sharing. And I think that's really important and probably will take some time to build as we move forward. But maybe if I give everybody one last chance to make some comments about particularly how do you, I mean, it's wonderful to say we want to build the trust and we all want to do that. Maybe each of you, if you could give us sort of one main area that you might want to work on right away to start to build trust in the system, and maybe give each of you a minute to sort of say what would be an action item that each of you would recommend, very quick notes of how we can start to build and action some of the points that we were talking about. So maybe do it in reverse order. Quality, do you want to start, and then we'll go back through the list?
Yes, my action item is simple. Have high level. When I say high level, I really mean high level patient representation at the regulatory level in the regulators, be they for information sharing regulators or be they for medicines regulation, because that's equally important. And then with the Ministry of Health, and even within the cabinet, you know, if there is a presidential committee, we should be having that high level present there so that we can create something for society. This is for societal benefit. It's not for individual patients, it's for everybody. And this is the future of medicine, you know. It is moving us from small molecules into genomic medicines, and we don't know where it will land. It needs that oversight. It's a societal responsibility. I think that's important, and high level representation. Thank you.
Thank you. Karla?
Sí, es muy difícil eliminar la corrupción, sobre todo en países de bajos recursos económicos y medianos.
It's very difficult to fight corruption, especially in countries where it's so ingrained on a daily basis. But education is very important in the pharmaceutical industry, among the employees and the government, so that, you know, they represent citizens, and everything that they do has to have a positive impact for citizens. Citizens, when they get sick, when they are patients, they need increasingly more ethics, because if we fail, the patient can die. If we fail on managing those data and sharing data, we have to look at the positive impact, because if patients do not benefit from data sharing, then we deadlock our trust building process. So we have to have empathy. We have to be careful with citizens who are sick, who are vulnerable. And this is really important. We have to respect that line to prioritize that vulnerable group. It's important to know that the patient needs the whole system, and the whole system needs to respond to the needs of the patient.
Thank you. Gonzalo?
Gracias, Russell. Creo que uno de los caminos que se deberían de tomar en esta...
Thank you, Russell. I think that one of the pathways that we can take regarding solutions is to integrate society, integrate patients in decision-making about healthcare. I respect the declaration of Almata that people have the right and duty to participate in the implementation of their healthcare, because we understand that data protection is part of healthcare attention. Then we have to have, since the beginning, the families and patients involved. They contribute with data, and they are concerned about the care in handling that data. So citizen participation is very important.
Thank you. Maria, very quickly, because time is running out.
Mil gracias.
Thank you.
En cuanto a la parte de la confianza, definitivamente.
So regarding trust, definitely it's important, because the advances of science and medicine depends on data from individuals. We have data from clinical trials, for example, and we have to set ourselves free from the idea that once we are in a clinical trial, we are guinea pigs. We have all the security measures for the patients and safety as well. So we have to shift that paradigm and give consent. I was part of the ethics committee for a long time, and I know how those clinical trials work. And also regarding what Gonzalo and Karla mentioned, in Colombia, we have the advantage of counting on a social movement. It's not a foundation, but it gathers 193 organizations of patients, high-cost patients. So we are represented by a lot of spokespeople. And since the pandemic started, we went each month to the Ministry of Health to comment on the main global problems of the healthcare system, to transmit to the Ministry of Health the importance of the issues. And if the patients are represented by people who care about their voices, then we have to have trust. We have to have their trust. The problem in Colombia with patient organizations is that a lot of physicians still do not trust us. The ideal would be that physicians would send their patients to our associations. Some of them do that. And a lot of them are peers in the associations. There are doctors and physicians in the association. So we have to build trust together so that we can create a stronger pressure group so that we can participate in collective decision making.
Thank you. I'm going to have to, unfortunately, to conclude. I'm sorry to cut you off, but there's another session right now. We could go on for a long time, but my apologies for that. Thank to all the panelists. This has been fantastic. I have several pages of notes of action items. We've got a lot of work to do, but I know we have a team in front of us here that is really interested in making it happen. And as we circle back and plan for the Summit of Americas, I'll be reaching out to you to try to take some of the items that we talked in terms of frameworks and building trust and communications and transparency, and we'll work on that. Andrew and I will follow up on it. So my apologies for cutting this wonderful conversation short. Over to you, Andrew, and thank you all very sincerely. This has been a very enlightening and helpful workshop. Thank you, Andrew.
Thank you so very much, Russell, Karla, Maria, Gonzalo, and Kawadeep, for really underscoring, as we like to say, that patients are the only why when it comes to all things in healthcare.